In this video, I'm going to talk to you about developmental delay, what it is, what to look out for, and what to do if you're concerned that your child might be delayed. Now, before we get into the nitty-gritty of it, it's important to remember that developmental delay is a very broad term. It's an umbrella term that we use basically when we first start realizing that a child might not be meeting his developmental milestones the way that we expect them to. And just before I get into it, I'd just like to elaborate a little bit on what we mean when we say that they're not reaching their milestones. It's very important to keep in mind that those developmental milestones are quite broad, and there's a range in which children can achieve these milestones. So please don't panic if your child is not crawling or walking or talking at the same time that most of his peers are. So what you want to do is just familiarize yourself with the expected age range for those developmental tasks. And if your child still falls within that age range, simply just keep monitoring his progress. Now, development doesn't always follow a typical pattern. It's true that most children learn to crawl before they learn to walk, but some children simply skip the crawling stage, or they bum shuffle and then go straight on to walking. So again, monitor it, but don't panic if it's not exactly typical. Your child also might seem delayed in one aspect and then advanced in another, or delayed and before you know it, they so quickly catch up to their peers that they're at exactly the same stage in a month or two. And always keep in mind that babies who are born prematurely will always be slightly delayed. So when you're trying to monitor your child's progress, make sure to measure it from the original expected birth date rather than their actual birth date. What is quite important is regression. That is a red flag. So if you notice that your child was able to do something and all of a sudden they lose the ability to do that, you might want to take him to see your healthcare provider. Also keep in mind that developmental delay is not a final diagnosis. It just gives us an indication that something is maybe not developing the way it should. And what we then need to do is further investigate to try and figure out exactly why your child is delayed in certain aspects. And there could be various causes for this. It could be a genetic difficulty. It might be that there were difficulties during pregnancy or birth, deficiencies perhaps in diet, maybe exposure to toxic substances, a whole long list of things. But let's look at some of the most common signs of developmental delay. So a speech delay, for instance, if your child is not speaking single words by the age of about 2 years, you might want to investigate further. And there could be various causes for this. It might simply be that there's a blockage in the ears. So sometimes we find that children's ears fill up with fluid, and because they can't hear clearly, that speech development never happens. And the most likely way to sort this out is that they usually go in to have grommets inserted. The grommets make sure that the fluid can come out of the ears and the child can hear clearly, and quite often the language very quickly then starts developing after that. It might be that there's an auditory processing difficulty that has to do with the way that the brain interprets the sounds that it receives from the ears, or it could be a sign of autism. Just very important again to emphasize not to panic too quickly. Autism is something that we only diagnose at a much later age. So if you're concerned, take your child to a healthcare provider, but don't necessarily start panicking that there's something very big that's wrong. We might find that some children are simply not growing. That could purely be because of dietary deficiency, or it could be that they have a genetic order. Or if your child is not walking round about by the age of 20 months, it could mean that there's perhaps low muscle tone. So even though we think about walking as an action mostly of the legs and then maybe a little bit of a swinging of the arms, the core muscles are very important there as well, because your core muscles really do the work of keeping you upright while your legs can move. And if those core muscles aren't strong enough, there might be a difficulty with walking. It could be a difficulty with coordination, perhaps a difficulty with bilateral integration, which is just a very fancy term for meaning that the two sides of the body work together in a coordinated way. It could also be that there's a hyperflexion of the joints, and so basically what that just means is sometimes the ligaments are slightly loose and the arms and the legs extend backwards into the joint a little bit further than they should. With all of these causes, early intervention is absolutely vital. So if you are concerned, schedule an initial appointment with your pediatrician. That's always the best place to start. And hopefully he'll allay your fears, tell you there's nothing to worry about, or if there is something else to consider, he'll most likely refer you to the right professional so that you can get to an idea of what's going on. Some disorders are really easy to treat. Sometimes it simply requires the administration of a supplement, such as vitamin B12, perhaps vitamin D, while others might require a full educational assessment or a developmental assessment to see where the child is, or perhaps even genetic testing to further investigate what might be the cause of that delay.